When you're working with patients who are suicidal and have severe mental health concerns, you try everything. At that point, they've tried everything. What more is there that we can do to help this patient?
To actually make this work on a national and international level, we need so many other people to do with, policy, regulation, and business and marketing and growth. Otherwise, it's not going to reach the people that need it. A lot of the Wild West cowboy ketamine clinic kind of VC bro people, they're no longer in the business because they went bankrupt.
You cannot flag whole plant around the country in major cities and expect to grow. Hanging your hat on any one modality of care is very risky.
Patient voice is so important.
Walking into Hope Mark came at a time when I felt exhausted in every way. Depression had taken so much from me that even getting through the day felt impossible. But the moment I stepped inside, something in me softened. I felt cared for. I felt human again. We have traditional evidence-based medicine that we're relying on. It's a tried and true and accepted model of care, a psychiatric practice. And now we're integrating new modalities of care. And so things as it relates to psychiatry and integrating, psychedelic medicine, the medicine is only as good as its physical attributes. The therapeutic side, we really do need the therapy side as well.
Hello and welcome to another edition of The Healing Mindset. My name is David Drapkin and I am here today with Meghna Geeta. She is the Chief Growth Officer of Hope Mark Health, and they're a network of clinics in Illinois with 6 clinics at the moment. So we're going to be talking about what exactly is Meghna growing at Hope Mark, and also what are some of the patients' experiences coming through their clinics, and particularly what's it like being at the threshold of the psychedelic renaissance, but also being an established clinic in a community already serving local people with mental health solutions. So I'd like to welcome you, Meghna. How's it going today?
Hi, David. Thank you so much for having me on your podcast. I'm very excited to talk to you today.
You got it. I'm really happy that we are here. We, as you know, we had your colleague Abid on, I think, our first ever episode. So it's really cool that we're working together. So do you want to introduce yourself to people? And I thought it might be nice to tell folks about the different hats that you've worn in your life, because you've gone through a bit of a business, marketing, and therapy kind of iterations of yourself. So who are you at the moment, would you say, Meghna?
Oh, sure. Thank you, David, for the opportunity. Yeah, so my Meghna Geeta, Chief Growth Officer at Hope Mark Health. And as you mentioned, I've worn many hats and found very different paths to where I am today. I, at the core, am a healthcare marketer. I started off in healthcare marketing back in 2000 and have worked in various different facets of the healthcare industry. Physician-managed healthcare practices. I've worked at Walgreens in their retail marketing department. I've worked at Twitter, actually, for a little bit in the retail side of their sales business. And most recently, before Hope Mark, I was at a private equity-owned dermatology practice that was 65 clinics large when I left as marketing director. So in the different hats that I wear, one of the avenues that I wanted to explore more was the therapeutic field. And so back in 2018, I started my marriage and family therapy master's degree at the Chicago School of Professional Psychology. And so I was doing both. I was in a master's level program, and I was also working as a marketing director. And so the two sides weren't necessarily working together at the time, but I kept going. And the role in the dermatology practice, I transitioned off of it. And I actually had a conversation with Dr. Nazir Abid. We're close friends from childhood. And I told him that I was really interested in getting into the psychedelic industry and I wanted to work with him. And right at that time, he was selling his practice to another clinic network and drug development company. And so it worked out where I actually was brought on as VP of marketing and then grew into the chief growth officer role there. And we started working together. And so now all of a sudden my psychology track and my corporate strategy track were converging. And at that point I decided I've completed all my coursework in psychology. I don't know if I really want to sit for the licensure yet. Let me pivot into growth strategy marketing for psychedelic and psychiatry-based clinics. And so that's kind of how I moved over to one side, but I do wear that hat. And I have pretty deep background now in the psychology space.
That must feel really nice to be able to use both sides of your brain, because often there is this,
Yes.
conflict within us around sometimes ethics and morality and what feels right, and then the need to kind of, feed the family and, earn a living and look after oneself. So it's great that you're doing both. And I think a nice way for us to start the conversation is around, what does a chief growth officer do and what are you growing exactly? But I want to just preface that by saying, Meghna, a lot of the time on this podcast, we have scientists and researchers and clinicians and psychiatrists and that kind of folk. Great. But to actually make this work on a national and international level, we need so many other people to do with, policy, regulation, and business and marketing and growth. Otherwise, it's not going to reach the people that need it. So as wonderful as the science is, I want to know, what does a chief growth officer do? What are you growing? Because that is a secret ingredient that we simply have to get right.
It's a great question. So, Chief Growth Officer, at least in this context, is responsible for connecting the dots between all the various facets of a business. So, as you mentioned, you have the operations, you have the clinical excellence, you have, finance, and you have the responsibility to educate the community. So, in this particular case, that's probably the number one thing that I do, is educating not only the patient, but our referring provider community and, schools, other educators, people who are all involved in a patient's care around their mental health, about the advancements in mental health care treatments. And since it's so new and post-pandemic, mental health care became really on center stage after COVID. It's been a prime opportunity for us to really work with the message that mental health is health. And it's not some, voodoo thing that talk therapy is, looked down upon. Medication management is looked down upon. You don't want to tell someone that you're on an SSRI or, you've even tried psychedelics. That conversation is changing. And so, as part of growing the Hopemark business and clinic network, education is paramount. And then it's the day-to-day, it is the business side. It is looking at where are patients coming from, what sort of conditions are they coming in that need treatment, how to grow our different modalities of care. So IV ketamine, Spravato, TMS business, working day to day with the operations team, understanding provider capacity, down to, how long is a provider working with a patient in a session? Where do we find more time in a day? And getting our own providers out into the community and working with other providers to talk about the importance of the different treatment modalities that we offer. So it all works together, and that is our sort of present day. But it's also looking at the past, what has been done before. And specific to our industry, since it is fairly new, there isn't a lot of precedent. And so we created a medical practice-based psychiatric platform. I know it's kind of long. But the idea there is that we have traditional evidence-based medicine that we're relying on. It's a tried and true, an accepted model of care, right? Psychiatric practice. And now we're integrating new modalities of care. And so things as it relates to psychiatry and integrating, psychedelic medicine, let's say, or therapy, there's a lot more acceptance now, I think, in the marketplace. And so, we're working hand in hand with our community partners, right, to grow the practice. So looking at the past and looking at the data and trying to build upon that. And then we're in the present day. And then what's the future? And the future, from my perspective, is hanging your hat on any one modality of care is very risky. You have to have a solid base of what you offer your patients and an integrated model of care. So that's what we look at, is our patient is at the forefront, and what kinds of care can we give them? What does that look like in terms of, is it therapy? Is it a service? Is it, accessibility? Is it offering them, payment options? It's a lot of different things that we look at in order to give the patient the best possible chance for the best outcomes.
Oh, there's a few things I'd like to go into there. I think the first thing is, you spoke about education a lot, and that's not growth. But because these are new interventions, new treatments, a little bit controversial, perhaps, there needs to be some education, awareness raising, removing of stigma, and just making sure people understand how this works and that it's safe and reliable. So I love the importance of education there and awareness raising. There's something else you said I want to ask you about. You were saying that these integrative mental health clinics that you've got at Hopemark, why are they better? Not that every single clinic has to be like that, but what are the advantages of having these more kind of inclusive clinical models rather than just saying, I'm going to do this one thing and just that one thing, and that's all?
Well, the one thing is that with our platform being psychiatric care, we're looking at a patient more holistically. And we're not looking at, the bell or the whistle that's come along and, everyone's sort of centering around one thing. It's evidence-based medicine that we're practicing. So we're looking at the whole patient and how to integrate the various forms of care that are available to us in a way that is going to help that patient. So for example, we have patients who just come to us for medication management, and that's all they need. There's nothing more to it. Then we have very complex cases that patients are on all three modalities of care. So they're concurrently in TMS, and they're doing Spravato, and they're on ketamine for various different reasons. And that's all based on evidence. One of the most important parts of who we are as Hopemark Health is that we only employ clinicians who have been trained in psychiatric care. So other companies have, different types of medical professionals who are building their practice. But in our practice, we only hire psychiatric trained professionals. So that makes us different for sure, and keeps us very consistent with that training model, with the way it's been built, in the healthcare model. And we work with other clinicians such as primary care providers, family practitioners, OBGYN. There's a direct correlation with the patient that they're seeing, where they can only treat them so far. And they have, treatment-resistant depression patients that they don't have enough knowledge to treat them with, right? And we're a subspecialty. So if you think about us in the ecosystem of the healthcare model, we are a subspecialty that a primary care provider would then recommend their patient to go see. So that's where the education piece comes in. So it may seem like it's not necessarily about growth, but one of the most important things that we've been doing in the last year and a half is we've built a robust business development team that is actually working to educate our provider community on who we are and what we offer. And the reception that we have is actually quite shocking, maybe. Is our BD reps will go in and talk to a provider and say, wow, where have you been? I have this patient, this patient, this patient, this patient. I want to send them all to you. And there's 4-month waiting list to get a patient in the door, at other psychiatric practices. And, we're able to see our patients within a 2-week period of time. That really puts accessibility in the forefront. So educating the community and our providers is a critical component of our growth strategy.
Thanks, Meghna. I put myself into the perspective of being a patient for a moment as I was listening to you, imagining I'm there, I'm seeing a psychiatrist for meds. Maybe I'm seeing a therapist too, because your clinics, a lot of them have therapists as well. But then if I need more, if I need TMS or ketamine or Spravato, how nice would it be if I could stay at your clinic with the people I know in the same system, rather than have to get a referral somewhere else, wait for that, do an assessment, see when they've got a space and go to this new place. There's something that feels like a neighborhood, like mental health community clinic around being able to get all those treatments in the same place rather than having to be referred out all the time. It normalizes it a bit as well. Because when I think, oh God, I must be really messed up if I've got to go somewhere else to get that treatment. I'm going to this place that sees, the really mentally ill people, gosh. But if it's all in the same place, it's all in the community, then it's just normalizing. This is what I need. I'm going to help myself get access what I need at this time. I can stay in the same place with the same team. I think that's just really normalizing around mental health at different edges of the spectrum.
Absolutely. That is one of the most important parts of who we are, is the community aspect of our healthcare. And patients come to us with exactly that in mind. You could go to a larger hospital system, but it tends to feel a little bit disjointed or a little bit more cold, but because we are an independent clinic network and our providers and staff are so in sync with each other, it permeates through the way we treat our patients. And, I'm going to maybe preempt you on this, but I do have a great patient testimonial that I wanted to read to the listeners today that truly describes why we show up every single day at Hopemark and what we're doing and the impact that we have on just even one life. That matters, and so
let's do it. Yeah, I'd love to hear that.
I can
Yeah, just to say that patient experiences, patient voice is so important. I've been a clinical director of a outpatient clinic, and that's the most important thing. Do we know what our clients' experiences are? Do we know what our patients are feeling? So yeah, thanks for bringing this. I'd love to hear.
Yeah, sure. Okay. Walking into Hopemark came at a time when I felt exhausted in every way. Depression had taken so much from me that even getting through the day felt impossible. But the moment I stepped inside, something in me softened. I felt cared for. I felt human again. The staff at Hopemark don't just do their jobs. They meet you where you are, even on the days when you feel broken or numb. They look at you in the eyes and really listen. They speak to you with kindness. They treat you with dignity. And when you're fragile, that means everything. I had days where I walked in holding back tears, and they still made me feel safe. They never rush me. They reassure me. They remind me gently that healing is possible. And even though I'm still fighting my way through depression and anxiety, I feel like I have a team behind me who truly wants to see me get better. If you're struggling and feeling lost, Hopemark is a place that can hold you up when you can't carry everything alone anymore. I'm grateful for every person there who has helped me feel hope again, even on the days I could not feel it for myself.
Wow. Thank you. Yeah, the value of hearing the patient's voice is amazing, especially that patient, they experience a lot of caring. So very subtle touch points around how your team made them feel accepted, safe, patient, just that level of care. That must feel good to hear that.
I was so excited to get this review. So part of my job actually is to listen to patient voices. And we do have a reputation management strategy in place. And we have over 300 five-star reviews across our 6 clinics. And for the size that we are, that's incredible. It speaks volumes to the type of care that we're providing and how our clinicians and the staff show up every single day to just change even one person's life. And what I think is different about Hope Mark is we have weekly meetings in which we're talking about specific patients, and the staff knows who we're talking about. People, it's not like, one person is asking a question about a patient and the other person has no idea who this is. We're having conversations about their journey. Maybe it's a financial issue, maybe it's a clinical concern that the providers are talking about. But the way the dialogue take place, it's as if this person is a friend or a family member, and there's a lot of love and care around all of our patients. Our clinicians meet twice a month in a treatment team meeting, and they have discussions about patient cases, and they work with each other. So it could be one provider's patient, but another one will chime in and say, have you tried this? Have you tried that? So behind the scenes, there's a lot of care that's being, put forth around every single patient that comes through the door.
All right, controversial question, perhaps. We're talking about growth. In a sense, we're talking about patient experience, success, and there's another word that we use in healthcare, kind of quality outcomes and quality metrics and KPIs, and tracking what is important quality. You've got 6 clinics right now, which is awesome. A lot of the Wild West Cowboy ketamine clinic kind of VC bro people, they're no longer in the business because they went bankrupt. It didn't work. Their model lacked something. For example, there was Ketamine Wellness Centers. They went bust in 2022, and Field Trip and Nushama. Sorry, not Nushama. They're doing great in New York. I'll redo this bit. What's the one called? Begins with N. Numinous. That's the one. Okay, so I'll say that bit
Yeah.
again. So there's been a lot of chains that got quite big in the psychedelic ketamine world. Companies like Ketamine Wellness Centers, like Field Trip, like Numinous. They had a lot of clinics, but it didn't last. So what is essential, say for one ketamine clinic, to grow to scale beyond just the one successfully, keeping quality in mind and patient experience in mind? How do you do it? And you just mentioned a few things there, like the meetings you and your team have, really talking about the patient experience. But what are some particular things of making sure we want to do it this way, not this way, the cowboy way?
That's a really great question. So, as I mentioned before, the core of who we are is an established medical practice. And there are guidelines and structure that exists that we've developed over the last, 8, 9 years now. So Dr. Nazir started Hope Mark Health as Advanced Psychiatric Solutions back in 2016. And I think what makes us different is that we're, again, looking at whole person care, and we're not, following the bell or the whistle or the new car. We're looking at how best do we treat this patient with what we have available today. And at the core of that, you really have to have foresight and understanding of your finances. So I would say the biggest thing that I noticed with some of these practices is that they flagpole, planted in every major city. they operationally didn't understand how it works to, treat a patient. Coding, billing, insurance reimbursement, pre-authorization, the timing of scheduling a patient, how you move them through the process, all of that matters. And so you can have 3-4 patients a day, and they're coming in, they're doing 3 hours of a journey. That's not going to make you money, unless your prices are really high. But we were trying to be a practice that's accessible and evidence-based and following a traditional medical model. And we've been successful. We've been able to, we have 5 psychiatric clinics and we have 1 therapy-only practice right now. And the goal is to grow, the footprint within Illinois, at least, all within the model and the platform that we've created. We have, our leadership team is built of leaders who've come from the healthcare private equity world and have built and sold practices. So the know-how exists. And it was, through this leadership team that came in and was able to build a platform that is now being recognized by other healthcare private equity firms. And just overall in Illinois, you'll see Hopemark Health has a name now, and it's taken some time to get here, but you can tell operationally a sound model. And that's what I would say, is that you have to really understand operations. You have to understand budgeting, and you cannot flagpole plant around the country in major cities and expect to grow. You have to follow where the demand and the need is.
Love it. And thanks for sharing those recommendations on what to do and not to do. On a more micro level, the same question again about particular treatments and modalities that you have in your clinics. How do you know which ones are needed? How do you know which ones will be successful, profitable, and in demand? And what particularly treatments-wise are you bringing into your clinics next, because it's what the community needs?
So when we started the practice, Dr. Nazir brought in IV ketamine in 2016. We were the first to bring it in the Midwest. And he has this innovative entrepreneurial spirit of wanting to not just look at what's been established, but really think about other models of care. And so was that necessarily based on a need? Maybe not, but it was of interest, right? It was something that was different and unique. And he knew, based on the research, that it could change lives. And so he brought that in. And then about, what are we in, 2025? So I would say 7 years ago, he brought in Spravato, knowing that this would be the next best thing as far as the fact that it was FDA approved and insurance covered, and gave access to more patients with the same type of modality of care. It's a cousin of ketamine. And then TMS came along, and we had one machine that we brought in. And again, Dr. Nazir, forged the path and said that we really do need to bring in this treatment option. The evidence is showing that it really helps treatment-resistant depression patients. So it's having a pulse on the industry. It's having a pulse on the research. It's having a pulse on the different things that are coming out there to help our patients. That's number one. Number two, when you're working with patients who are suicidal and have severe mental health concerns, you try everything. At that point, they've tried everything. What more is there that we can do to help this patient? So that's when I was telling you, we have patients who are in different, all three, treatments for different reasons, but it's helping them progress. In looking at the need for our patients, one of the things that I look at on a daily basis are the patients who call in who we're unable to treat for a variety of different reasons. So they'll call in looking for an FOID card assessment, or they're calling in for neuropsych testing, or they're calling in for, Medicaid is a big one. So we don't accept Medicaid at this time. Child psychiatry. So I looked at the data of all of the different phone calls that we were getting and the requests we were getting that we were unable to fulfill. And two stood out. One was neuropsych testing. And even within our clinic network, our clinicians were referring out for neuropsych testing. And anywhere you go, it's a 6-month waiting list. And so the opportunity it presented itself as bringing neuropsych testing in-house, which we did. So in this last quarter, we brought in a psychologist, and we already have a 3-month waiting list. And it started with just our own internal patients. We haven't even really broadcast that we have it now until today, telling everyone, but we saw the need and we went in that direction. And from a business standpoint, and from, of course, looking at it from the money aspect of it, it is a lucrative business. And we need that in order to keep the lights on, to be able to continue treating patients who need care. And then child psychiatry. And it's definitely something that we've been looking at as bringing in as part of our, suite of options and holistic care, integrated care model. Early intervention is really important. And, with a lot of these novel therapies, the treatment age is around 17, 18 years old. But we do get, unfortunately, young teenagers and even younger than that who are really suffering. And so being able to treat them with the same level of care and being their healthcare partner is really important to us. So we've been looking at what that could look like within HopeMark. What's nice is that the different TMS manufacturers, and specifically the one that we're working with, just received FDA approval for adolescent care. And that's going to be huge. So that's definitely something that we're looking to address and bring into.
Brainsway, the TMS manufacturer? Great.
Mm-hmm.
Yeah. I think we mentioned that in a previous episode. And a few episodes ago, we were talking with Melissa Whippo about research she did with adolescents using ketamine as well, because it hadn't been done before. And there's efficacy there, especially in a family systems approach. So there are these needs, there's these great technologies. We need these people to kind of match them together in responsible ways. So I love that, how as time went on, Meghna, you and Abid went methodically, here's a new technology, here's a new need in our community. Let's make it happen. Let's be that place where we can help them to access it. So I love that. I want to now ask another question. And we were talking earlier about the default mode network, and it refers to the brain. It's Robin Carhart's model of kind of shaking up the snow globe in a way and just freeing the brain with a bit of anarchy and entropy. So it moves out of its normally ruminating, narrow, limited pattern of functioning in our brain. But I'm saying actually our healthcare system is this more narrow, rigid, limited pattern of tradition of how things are done. And in comes psychedelics, this disruptor to the default mode network in the brain, but it's also a disruptor to traditional healthcare. So how do you see these two immovable forces living together now in the work you're doing, but also looking further ahead as treatments like MDMA and psilocybin, hopefully and soon, are approved by the FDA?
Yeah, I mean, this is a really important question, a very important topic, right? As it relates to psychedelics in the medicine space. My thinking, and actually evidence that I have, is it works together. And they absolutely live in the same ecosystem. We already offer ketamine assisted psychotherapy as part of our suite of offerings. And so that's built off of this, new model of care. And we've built a proprietary CAP program. And I believe we're the only one in Illinois that's doing it in the way that we do it. And we've figured out how to take something that is so unstructured, let's say from a psychedelic standpoint, and create structure around it. And the patients that go through our CAP program come out on the other end with incredible results. And it's an critical component of psychedelic treatment. And anyone you speak to, at least at Hopemark, will say the same thing. The medicine is only as good as its physical attributes, but because you're talking about the mind and you're talking about the neuroplasticity that starts to open up with psychedelics, and the types of emotions, let's say you've repressed, or trauma that you've repressed, the therapeutic side of it is so critical to create a container, a safe container in which, as these things start to open up, your safe space, your therapist, is helping guide you through that process and helping uncover and reduce the triggering nature of traumatic experiences. I think moving forward with MDMA last year, when they didn't get the approval, this was the biggest concern, actually, was, well, one of their concerns at the FDA was, how do you approve a drug that has a therapy component as part of it, and there's not enough guidelines around it? There's a lot of subjectivity there when you're talking about medicine that's very structured and tangible. And I think now they're moving in the direction of, let's remove that component. Let's talk about the drug itself. And there's efficacy there, no doubt, right? But those who really understand the compound and how psychedelics work know that there's only so far you can go with medicine alone. You really do need the therapy side as well.
Yeah, that's great. And let's jump into that one, Meghna. You're talking about systems. You're talking about preparation and integration, building the container, having solid protocols. That's going to reassure people. And in a sense, as chief growth officer, at the beginning, you're saying you're educating, awareness raising, local, community, people, patients, families, but also other medical practitioners. So there's a meta piece here that you're doing also. You're actually educating on a national level that this is safe because we're building the structures and the systems and the protocols, preparation, integration. And there's one other thing just to go into, training. I'm hearing you saying our practitioners have got to be so skillful and competent at working with clients so that we can earn the trust of these more traditional default mode network healthcare institutions. So how do you handle that piece at Hopemark around practitioner training and competence to work with these novel therapeutics?
So as part of one of the many hats that I wear, I actually am the first sort of gatekeeper of who enters Hopemark. So I manage and run our recruiting. And when we have an opening and we discuss that, we need to hire a clinician, they come through me first. And so I go through, usually it's a fairly quick, but, informational interview to understand who they are and how do they fit into our cultural values and work ethic. Those are two that we really look at. And as I mentioned before, we only hire those that have been trained in psychiatric care, have some sort of psychiatric degree. So once they've entered into Hopemark, we have a rigorous training schedule, and Dr. Nazir's at the helm of that. So he sits with, each provider for days and going through all of our novel therapies. We connect each provider with, the manufacturer of the novel therapy. They get very well educated and trained. And then we sort of launch them into, basically their own practice, not without oversight, not without the fact that there is plenty of people within the Hope Mark Clinic network that the providers can rely on, right, to get education and help from. So as I mentioned, those treatment team meetings, and then of course, Dr. Nazir is always there to be guiding these new clinicians through the process. So we pride ourselves on the training and the education that they receive, and we've had little to no complaint on, the fact that they're unprepared. They're probably overprepared in some cases. There's a lot of information that we provide our clinicians.
Awesome. So you've got this gatekeeping hat as well. You wear many hats. Yeah.
I wear many hats.
Yeah, lovely. And
yes.
Final question. You are a member of Chief. So I'd love to hear what that is. Yes. And we spoke about it briefly, but it sounds like a really important organization and community for women in business to be part of. So what's your experience been and what is Chief exactly?
So Chief is a leadership organization for women executives. And the founders, about 6-7 years ago, saw a need where as women progress in their careers and they take up leadership roles, it starts to become a little bit lonely at the top. And there's not a lot of other women leaders within the organization or in other companies around you that you can network with and learn from and grow with. And so Chief, saw that need and created this organization. I don't know how many members they have at the moment, but I know it's in the tens of thousands of members nationally. And so it's been an incredible experience getting to know really, educated and experienced women in all walks of life: law, medical, finance, nonprofit, marketing, operations, you name it. And they bring on some really great, keynote speakers. They host different types of experiences for women to learn from each other and to grow and to just network. And so I've met actually some great friends here through the network. And at any one point, it's sort of that, hey, I need help with this. And all of a sudden you just post it on the Chief Network and you have hundreds of people responding to your request. So it's nice to have that sort of executive, sort of exclusive group of women that you get to engage with. Interestingly enough, when we were in the process of renaming Advanced Psychiatric Solutions, I worked with a chief member who does naming and branding experience. So we went through a whole branding and naming process, and went through the trademarking process. Even the lawyers that we worked with for that came from the Chief Network. So a lot of my partners that I work with, on the business side and the growth side, are actually women that I've met through Chief.
Amazing. And if it's okay to give a shout out to one particular friend of yours in Chief that was previously on the Healing Mindset podcast, Jody Green, a friend of mine and ours. So yeah, she's amazing. She was on the podcast just after she did her Vipassana retreat, marathon runner, psychedelic lawyer. So you were telling me, is that okay to talk about it? Or is it a bit of a secret organization, or is it okay to out her as a chief member?
Oh, I'm sure she'll be fine with that. And that we met at a holiday party 4 years ago, and I had just started working in this business, and she said to me that she was a psychedelic lawyer. So we became fast friends, and she's been a great friend and also colleague in the network, helping. I've met so many people through her. Actually, she was the one who introduced me to the naming agency that we used. So yeah,
Yeah,
she's a great
love
friend.
calling out. Okay, Meghna, anything else that you haven't covered that's top of mind or kind of bubbling away?
I know. I think this was a really wonderful conversation. Thank you, David, for the opportunity. I think there's never enough education to around, you know, the treatment options that exist for those that unfortunately are suffering from mental health conditions. And so whatever we can do, whether it's educating at a business level or educating, the community or the patient, these types of opportunities are great for getting our voices out there and helping, that one person come in and change their life.
Meghna, thank you. For folks that want to find out more about you personally, where should they go? And about Homemark Health, where should they find out more information?
HopeMarkHealth.com. And we have 6 clinics, and I know, I have 6 clinics in Chicago, and the surrounding suburbs. So we have one in Millennial Park, we have a West Loop therapy practice, and then we have Orland Park, Naperville, Oakbrook, Hoffman Estates.
Fantastic. All right. This has been David Drapkin and Meghna Geeta on the Healing Mindset podcast. Thank you so much, seriously, for listening and watching this episode. See you next time. God bless.